Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone. Today, we're going to talk about a commonly prescribed medication, furosemide. Let's see how and when to use this diuretic. Furosemide is mainly used to treat fluid buildup caused by heart failure, liver scarring, or kidney disease. It also helps treat high blood pressure. It is quite effective when your body needs help getting rid of extra fluid. So, how does furosemide work? It belongs to a class of medications called diuretics, sometimes known as water pills. It works by making you pee more, which helps your body get rid of extra water and salt. Regarding dosage, it is crucial to follow your doctor's instructions. It is usually started with a low dose and gradually adjusted until the maintenance dose is reached. It can be taken with or without food, but keep in mind that taking it later in the day could lead to trouble sleeping due to needing to pee at night. Now, let's talk about side effects and precautions. While furosemide is effective, it can cause side effects such as dehydration, electrolyte imbalance, or changes in blood pressure. It is important to monitor these and consult with your doctor regularly. In conclusion, although furosemide is a powerful tool for managing fluid retention and hypertension, it should be used carefully and under medical supervision. Always make sure to follow the prescribed dose and pay attention to any potential side effects. Take care.
If you've made it this far, let us know in the comments why you're using this medicine.